When I was a physician associate student, I ended up in the AMU one Wednesday afternoon, of course to do some bloods. Formative, summative, you know the drill. And in my wandering, I met the consultant, one highly credentialed professor. Like always, I gave him the introductory spiel, and before I knew it, I was in the middle of a teaching session and I grabbed it with both hands. He had recently seen a patient whose presentation suggested possible malignancy of the head of the pancreas. This was big boy stuff. I was enjoying every moment of it. But like always with these consultants, they and their questions are inseparable. The boss asked me if I knew any anatomy. Between God and man, if I were to tell you, I was aware of the celiac axis, common hepatic, gastroduodenal, the superior and inferior, pancreato-duodenal, splenic artery, and how it supplies the till in the body. When I was standing there in front of the professor, I'll be capping like nobody's business. I had to raise my hand up and say, I don't know. I expected him to look at me in disappointment. He looked at me with a gentle smile and said, the most dangerous clinician is the one who is incompetent but doesn't know that he is. Basically, he called me dumb, but congratulated me for knowing it. The professor's comment has stayed with me since I was a student till now practicing as a physician associate. It has been a guiding hand, and I believe every physician associate, be you a student or practicing, will find yourself in this position at one point or another in your life. The truth is, on every clinical decision you make, you'll be in one of four places. It's either you are competent or incompetent, conscious or unconscious about the facts. This literally gives us conscious competence, conscious incompetence, unconscious competence, and unconscious incompetence. That was a mouthful. Of the four stages, the unconscious competence is the domain of the gods, the ultra instinct of medicine. It's a level only a few people reach. These people do not rely on textbooks and guidelines. They are the embodiment of the textbooks and guidelines. They think from first principle. Okay, the brain works in this way, the kidney works in that way, the liver works in that way. I've never met this situation before, and they're able to derive like they're deriving equations. These people are the creme de la creme of the creme. I've only met two consultants, I think, were at this level. They were just flipping mind blowing. And unlike the common mortals like us, these people are not acquainted with the universal face-saving phrase of it is one of those things. I think they are unconscious about their competence precisely because of their vast knowledge. They've pushed the envelope so far that they are aware there are other things that we need to discover. Because of their thirst for knowledge, they don't fall prey to the hubris of we that know nothing to think that they figured everything out. They are at the opposite end of the Kruger curve. The next is the consciously competent, the folks who move along the well-traveled path of their predecessors. They dot their I's and they cross their T's. They follow the guidelines and the various protocols, and they know when to deviate from them. They've been battle tested and they have the scars to prove it. This is the maximum some of us will ever reach. And to be honest, it is no small feat. This is where you find the average consultant, your GPs, partners who have been working for 20 years, 10 years. They've seen all kinds of stuff. They've made all kinds of mistakes, learned from them. They are working with a map. They are working with an understanding of the human body. That is crazy. Then we have the conscious incompetence. I think this is the rightful position of every beginner, because nobody comes out of their mother with a completed reading list. We all have to crawl before we walk and then learn to run. With the price of ignorance being knowledge, you have to put your ego aside and seek knowledge wherever you can find it. Those ahead of us are not there because they are special. They are there because they know something you don't. Libraries are everywhere, and the internet is ubiquitous. There are books in which the knowledge is. They are not hidden in the vaults at the Vatican, not in some archives written in Latin. And to my knowledge, there is no information brain barrier that prevents information from seeping through the brains of non-MBBS holders. If you read the first time and it does not go in, read it again. The unconscious incompetence. This is what the professor was warning me about. It is the fact that you don't know that you don't know that is the problem. And this is also a strange one, because the thing to be known is not even in your zeitgeist. So how does this reflect poorly on one's character to make them dangerous? The issue is you might operate on the false assumption that you know. You will make confident decisions that could have deleterious, irreversible outcomes. Case in point, back in the 1800s, a Hungarian doctor working in Vienna noted that women giving birth under the care of midwives died less frequently than those giving birth under the care of doctors and medical students from a disease called childbirth fever. It was rather rampant at the time. He noted that the obstetricians and the medical students were doing autopsies, dealing with cadavers, before seeing the women in the labor wards, examining them and helping them deliver their babies. Midwives, on the other hand, were not doing the same. The doctor thought that perhaps there could be some particles from the cadavers that was being transported by the doctors, infecting the woman. He proposed that the obstetricians and the medical students wash their hand with chlorinated lime water because he had noted that it was able to get rid of the putrid smell that was associated with the autopsies and dealing with the cadavers. When he implemented this experiment, the mortality rate dropped from 18% in the doctor-led clinic to 2%. In view of his observation, he recommended his solution to the obstetricians of his time. But the who is who's of the medical community rejected his solution, denounced him, and labeled his work as mere quackery, mainly because it was contrary to the orthodoxy of the time. Miasma, for humors, they just did not take him serious. And unfortunately for Ignaz Semmelweis, the germ theory as we know it today and accept it was not known back then. The idea that fungi, bacteria, viruses could be responsible for diseases was absolutely no-no. Meaning, Ignaz could not provide a theoretical explanation for the observation he was seeing when he asked people to wash their hands. So the medical community in Vienna rejected it. Through his back and forth with the medical community, it is speculated that he had a nervous breakdown. He was put into a mental asylum where he died 2 weeks later from, I think, a gangrenous infection of the sorts. A couple of years after his death, the likes of Pasteur and Lister gave the theoretical backbone to his observation. Today, we know that the childbirth fever often at times is caused by the bacteria Streptococcus pyogenes. But the doctors at the time, they did not have this information. They did not have this knowledge, but they deemed themselves knowledgeable and competent and ignored the observational evidence because the idea that they, the doctors, could be vehicles for the infection was at odds with how they perceived themselves. They were gentlemen, and there was no way for a gentleman to be unclean. If it was knowledge, they had it. And if they did not have it, it was not knowledge. That is the danger of the unconsciously incompetent individual. Their decision to ignore Semmelweis, even though he was right, ultimately resulted in preventable deaths. Now back to us. It is easy for us to say in hindsight that, oh, maybe we would have done things different. But the truth is, we could be committing the same mistakes today as physician associates. Posterity will judge us. We just have to learn to avail ourselves to knowledge wherever we find it. Disregard our egos is difficult, but it's necessary. Take criticisms to the chest. If they are valid and your shortcoming has been pointed out, you learn from it. If they are not valid, then it's one of those things, let it go here and go there. If you want to learn more about the foundational knowledge necessary for a physician associate, click on this video. If you want to learn how to avoid falling prey to the unconscious incompetence syndrome, click on this video. It's your boy Yoti, and I'm out. Salute!